Hi, my name is Dr. Megan Wiley. I'm a physical therapist at Balance Within Integrative PT. And today I want to talk to you a little bit about low back pain and how your pelvic floor might be related to it. So we see a lot of patients with low back pain and there's lots of different causes for it. Traditionally, if you go in to see a physical therapist for low back pain, they often are going to look at lots of things like your posture, your alignment, your flexibility in your legs, maybe the strength of your hips and your legs and your abdominal muscles, and do a bunch of different testing, which is all really great and helpful information to get. But one thing they might not always look at is what is your pelvic floor doing, and could it be connected to some of the symptoms you're having? So the pelvic floor is a group of muscles that are on the bottom of your pelvis, and there's lots of jobs of it, but one of its big roles is to help stabilize your pelvis. So it kind of is like a bowl on the bottom of your pelvis. So when it's working right, it's nice and strong and it has good stability through your pelvis. Now, sometimes if these muscles get really tight, they can pull on that pelvis and tug on that pelvis in different positions, and as a result, you can get low back pain from that. Or if they're really weak, if they're not engaging the right way, you might not have the stability you need from those muscles, and as a result, maybe your low back kicks in more and you start getting pain from that. So when we think about what your core muscles are, your pelvic floor is the bottom, like I mentioned, it's the bottom part of your core. Then you have your diaphragm up on top here, and then you have your abdominals around the side. And so they work together, and if you're not having good engagement through that bottom, through your pelvic floor, your abdominals aren't going to fire as well too, and that can really affect that whole pelvic alignment and contribute to back pain. Sometimes too, I find that if people have really tight pelvic floors, that can refer to the hip pain, to the hip area or the low back area as well. So some of those pelvic floor muscles are actually hip muscles, so deep hip rotators. So often I'll see patients who have this stubborn, deep buttock pain that just won't go away, and they've tried everything, but then we get in there, look at their pelvic floor, release that, and then it goes away. So I would encourage you, if you're dealing with stubborn low back pain and it's just not getting better, you just feel like you're not getting to that 100%, look into what maybe your pelvic floor is doing. Ask if you think it could be related. I would recommend you give us a call and we can see you for a free discovery consultation and talk about your different symptoms you might be having and how we can help out with that. Or you can check out our website at balancewithinpt.com and you can get some great educational resources there as well. Thanks so much, and I hope to hear from you.